Earlier this year, the NHS published its 10-year plan, setting out the priorities for the service for the next 10 years, and talking about some of the important developments that are happening in wider society that mean the NHS has to have a good think about how we design, deliver and offer services. There's a couple of key elements to the plan. It focuses on a couple of core areas of disease and illness, and one of these areas is mental health. And there's a big focus also on child health, physical health and mental health in there, which is good news for Oxleas because it talks a lot about a lot of the services that matter to us. There's also a real focus on how we deliver services in terms of use of digital channels, the new things we're learning about medicines, about how diseases affect different cohorts of people, about population health and public health and how we can invest in that to give people better chances in the long term. It talks about health inequalities, how where you're born, the circumstances in which you're born and where you grow up can really affect the lives you live. And I know a lot of our staff see day in and day out the effect that life chances have on people's health and well-being as they grow through childhood into adults and then into old age. And the final thing it really looks at is the structures of the NHS and the organisations we work with and how we move away from a sense of trusts being castles and commissioners asking for things from these organisations and then us having a negotiation from different sides of the table about how we get the best results to move into much more integrated structures based around the places in which people live and the way in which communities can support people to be well and healthy. The kind of stuff we're doing in Oxleas, in Bexley Care, in Greenwich and as part of One Bromley. So I recently joined our governors and talked to them about my initial thoughts on the plan and some of the things it says about Oxleas. And you can see in this short film some of what I had to say. We talk a lot about integrated care and sometimes we make it sound very complicated. It isn't really. Integrated care just means that you coordinate the services you provide around the person that needs them. And I mean, one of the reasons I got into the NHS is my mum's got MS. Three of my mum's family have got MS. What was interesting for me with family members with MS was seeing what it was like for them trying to join up all the different health and social care services they needed and how frustrating that can be. And the same experience many of you will have for all kinds of long-term conditions, for chronic mental health conditions, for chronic physical conditions. And actually integrated care means we take away those barriers and we just try to make sure that people don't have to tell their story 30 times with 30 different individuals. That means that we have one set of records that people can access in the way that our district nurses can, if they've got a signal, get their iPad out and have a look on Rio and see what's been updated from the mental health team that might have seen the same person yesterday. I was in Bexley just earlier today with the older people's community mental health team, and they'd been working with the home treatment team today to look after one of their clients who had needs that spanned both those teams. They said we got into a room together and we talked about what this gentleman needed and how we could both work together to deliver that. That's integrated care. Digitally enabled care as well. We're in a situation where a lot of what the NHS does is, in terms of digital, actually rooted in the 90s, really. You know, I can go into my bank account online and look at every single detail of all the transactions I perform in there. And yet, if I want to make an appointment at my GP's, I have to go there during working hours and I have to sit on the end of a phone in a queue of people desperately hoping that I can get an appointment. Now, there's models that are changing around this and they're making it much more accessible. And actually in the last couple of months, my practice is now starting to offer a range of digital ways to book your appointments and to actually think differently about how you might take those appointments. But there's a lot of what we do is still quite dated. Now, if you look at how we all use digital these days, you know, it's my mum's birthday today, and we've all been sending each other photos and videos of the kids singing happy birthday, and we'll probably have a FaceTime call tonight just to have a conversation about that. There's a lot of healthcare could be delivered in those ways. I don't know how many of us in this room have gone to an outpatient's follow-up appointment and have arrived to speak to someone who you've not seen before, who then digs through your notes and says, "Why are you here?" You say, "Oh, I had a scan and I was told I had to come back just to check if it's okay." I say, yeah, it's fine. I think, right, thank you. And, you know, it took me an hour to get here and get parked, and I've just paid for 3 hours parking. And, you know, I've had to take a half day out for it. And you think, actually, you know, for a follow-up outpatient's appointment, can we make it as a phone call? It doesn't need to be a FaceTime call. But can we offer people digital routes into some of this care? We've now got GP services that are offering appointments through laptops, through webcams, you know, onto your phone and so on. Now, this will not work for everyone, but for me, it's something that will work for some people. You know, and if we've got someone who's coming through and we say, "Do you know what? We think you need a course of cognitive behavioural therapy," and you can either come into a clinic setting and see someone face to face, or if you want, you can choose to see someone, you know, through your iPad, and have those appointments through an iPad at a time you're choosing from a place you're choosing, some people will say, yeah, that works for me. And what this is for me, it's not about taking away a physical face-to-face service and replacing it with something digital. It's for offering people that other route and then saying, we'll look at our resources so that someone who needs more time face-to-face gets it. So that actually, if you've got an 82-year-old with complex health needs, they get half an hour with the GP rather than 10 or 15 minutes with them, because some of the other people like me who just want to come in and have a quick appointment and get out and go, we can do that through other routes. So there's a big focus in there, and also on records, allowing you to look at your patient records online and to look at your letters online and to look at that in the same way that we look at so many other aspects of life these days. There's a lot of talk in there about care quality and outcomes. The more that we understand about care and the impacts it has, the more that we think about outcomes in terms of people living a good life. And that's really interesting for me. We've talked to you as a group of governors before about outcomes. And for some of our mental health services, how do we really know that they're working? You know, how do we really measure whether these are having a positive impact on the people we're caring for and on their families? So there's been a good focus in there on that, and it's a discussion we as Oxleas are taking forward over the course of this year. I've mentioned health inequalities. We've also got value for money in there. The NHS, it's got a huge budget. You know, it's in excess of 110, 120 billion pounds. You know, it's a massive area of public expenditure. I mean, if you do look across Europe, the level of investment in the UK is relatively low compared to some other countries, but we get great outcomes for that. At Oxleas now, over the last 5 years, we've taken out £40 million worth of recurring costs by making changes and savings to the way that we run the service. And actually this coming year, we're going to have to save another £9.5 million to try to balance our budget. But we're trying to do that in a way that preserves the quality of care and keeps us as a healthy, sustainable organisation. And the NHS as a whole, part of the deal for that £20 billion is to deal with some of the really big deficits we've got and make sure we can invest that in new services, not just use it to plug gaps in the old. So whenever I talk to groups of staff about some of these things that we're going to have to do over the year, I do try to talk about this because it's important. It's taxpayers' money. We have to think about how we reduce waste, eliminate waste. The point of having people like me in organisations like this, I can't deliver frontline healthcare to anyone. I wouldn't know what to do. But what I can do is I can try to make it easier for our clinical staff to deliver their job in the best way possible. And that's where we can have a focus on the value for money. I mean, one of the challenges I set myself is, can I help this organisation save considerably more than it costs them to employ me? And I think if the answer to that is no, as a senior manager, you shouldn't be in the place. So we have to think about value for money. How do we get as much of our money as possible into clinical staff who are delivering good quality care? And the plan does frame itself in a way that talks about value for money and getting that right value out for taxpayers. And then the last thing, workforce. I'll say a couple of things about workforce. It recognises the importance of workforce. All the NHS is workforce, really. You know, our organisations, NHS Trust, we spend 70% of our money on staff. That's where the cost goes. You know, that's where the money goes. The biggest increase in Oxleas' expenditure this year is on changes to Agenda for Change and changes to staff pay scales, and that's rightly so. That's where the money should go. But we do have a big problem nationally with our workforce. There's currently around 100,000 vacancies in the NHS nationally. Oxleas is very fortunate in that our vacancy rate is one of the lowest in London, and that we've done a lot of work on that. But if you look at all these things that are mentioned in the plan, you look at this investment in IAPT services and talking therapies, you look at the investment in children and young peoples, you look at what we want to do around community teams, you can only do that if you've got the people to deliver it. And the problem with NHS service changes is, to get the staff for the service change, you need to have started 5 years ago, because you can't train people overnight. And one of the challenges we're going to face over the next couple of years is, how do we make sure we attract, retain, train up, support and develop our staff? Because if we don't have the people, we can write all the plans in the world, but the care won't be delivered. And actually that means for us as a trust, we need to be a great employer. We need to be an employer that values and supports our people, that gives them the right tools to do the job, that gets the things out the way that stop the job being a pleasure for them. I mean, when I go out and talk to our teams, the things that people tell me they're most concerned about repeatedly, it's actually stuff like parking, it's expenses. I met one of our staff earlier today at the Older People's Community Mental Health team. I said, how are you finding the job? She said, do you know what, I love it, but I'm spending more and more time filling in records. You know, I spend more time now recording what I've done with patients than I do actually sitting with them and talking about their care, and we need to get that balance right. So the development of the workforce and the way that we support them is a really critical thing for us.
And actually in all this plan, there's a couple of things that we need to be conscious of that are affecting this. One is the workforce shortage, how we train and develop people to fill that. The other is, and this feels very proximate, and by the time we complete this film, it will all have changed again, but we have got Brexit. We as a trust, 5% of our workforce are EU nationals. There's other trusts with a much higher reliance on that. But we need to make sure that the message is there that Oxleas welcomes and values its overseas staff, whether they're from elsewhere in the EU or elsewhere in the world. There's some of our services, if you go along, they are delivered almost entirely by members of staff who are not British nationals. And and we rely on people to come and work with us and help us. We value them. They need to recognise that value, and they need to feel confident that they can come here and work for us and be supported and be part of what we at Oxleas are trying to do. And that's a really big challenge for us. It's a challenge for the economy as well, because the £20 billion the NHS has to come from somewhere. Actually, if the economy as a whole is healthy, then the NHS does well out of that. If the economy suffers, then people need to think about where they invest and prioritise. And although we've got a good deal here, and we should recognise that this is a good deal, there are factors outside the NHS's control that could have a big impact on that. But from my perspective, I think the plan, it's a series of great goals for the NHS. It says the country values the NHS and will invest in and support it. And ultimately, though, for me, it says take care out into the community, invest in mental health, invest in community physical health, invest in the support we provide for children and young people, and integrate care. And actually that describes what Oxleas does. So if you don't have time to read the full 70, 80, 90 pages of the plan, to sum it up, it says keep doing what you're doing at Oxleas and do it as well as you possibly can. And I think for me it's a really heartening message that everything we're trying, the things we're doing with Bexley Care, it's hard work to do this, it's hard work to get these models in place. But we know that ultimately the work and the effort we're putting into this is right, and the national plan says it's right too.
So there we have it. I hope you found that interesting. There's been a lot of development since then. We're talking much more about workforce now and what that means, and also there's been some really interesting developments in how the NHS can work with digital and how primary care networks are taking shape. So if you're interested in this kind of thing, and we all should be, there's lots more to find out there and read about. But thank you for watching the film, and I'll speak to you again soon.